Hello, I am Dr. DeAndre. Today I will talk about the early signs of colon cancer that you should never ignore. Colon cancer, also known as colorectal cancer, is one of the most common cancers worldwide, affecting millions of individuals each year. What makes this condition particularly concerning is that it often develops slowly over time, and in its early stages, it may not cause obvious or severe symptoms. This is why many cases are diagnosed at a later stage, when treatment becomes more complex and outcomes may be less favorable. From a medical perspective, colon cancer typically begins as small, non-cancerous growths called polyps that develop on the inner lining of the colon. Over time, some of these polyps can transform into cancer. This process may take several years, which provides an important window of opportunity for early detection and prevention. However, the challenge lies in recognizing subtle warning signs before the disease progresses. Many patients initially dismiss early symptoms because they resemble common digestive issues such as gas, constipation, or mild discomfort. This delay in seeking medical attention is one of the key reasons why awareness is critical. Clinical data shows that early-stage colon cancer has a significantly higher survival rate compared to advanced stages. In fact, when detected early, the 5-year survival rate can exceed 90%. In this video, I will explain the most important early warning signs, the physiological reasons behind them, and when you should consider medical evaluation. The goal is not to create fear, but to provide clear, evidence-based information that can help you make informed decisions about your health. One of the earliest and most commonly reported signs of colon cancer is a persistent change in bowel habits. Under normal conditions, bowel movements follow a relatively consistent pattern based on your diet, hydration, and lifestyle. However, when there is an abnormal growth in the colon, it can interfere with the normal movement of waste through the digestive tract. Patients may notice symptoms such as prolonged constipation, frequent diarrhea, or alternating patterns between the two. In addition, stool consistency may change, becoming narrower or unusually shaped. This can occur when a tumor partially obstructs the colon, altering the way stool passes through it. Another important symptom is the sensation of incomplete evacuation, where an individual feels that the bowel has not fully emptied even after a movement. From a physiological standpoint, these changes are often related to disruptions in peristalsis, which is the coordinated muscle movement that propels stool through the intestines. A tumor can interfere with this process, either by physically blocking the pathway or by affecting nerve signals that regulate bowel function. It is important to understand that occasional changes in bowel habits are common and usually not a cause for concern. However, when these changes persist for more than 2 to 3 weeks without a clear explanation, they should be evaluated. Clinical guidelines recommend that persistent bowel changes, especially in individuals over the age of 45 or those with a family history of colorectal cancer, warrant further investigation such as colonoscopy. Ignoring these symptoms can delay diagnosis. Early detection at this stage can significantly improve treatment outcomes and may even allow for removal of precancerous lesions before they develop into cancer. Blood in the stool is one of the most important warning signs that should never be ignored. It may present in different forms, depending on the location and severity of the bleeding. Bright red blood typically indicates bleeding in the lower part of the colon or rectum, while darker, tar-like stools may suggest bleeding higher up in the digestive tract. In some cases, the bleeding may not be visible to the naked eye. This is referred to as occult bleeding and can only be detected through laboratory tests such as a fecal occult blood test. Despite being invisible, this type of bleeding can still lead to significant health consequences over time. The underlying mechanism involves the tumor damaging the inner lining of the colon, which contains a rich network of blood vessels. As the tumor grows, it can erode these vessels, leading to intermittent or continuous bleeding. Even small amounts of blood loss over time can result in iron deficiency anemia, which may present as fatigue or weakness. While conditions such as hemorrhoids or anal fissures can also cause rectal bleeding, it is not possible to distinguish the cause based on symptoms alone. This is why medical evaluation is essential. Studies indicate that a significant percentage of colorectal cancer patients report rectal bleeding as an early symptom, yet many delay seeking care due to embarrassment or underestimation of its seriousness. Healthcare providers typically recommend diagnostic procedures such as colonoscopy to identify the source of bleeding. Early identification of the cause allows for timely treatment and can prevent progression to more advanced disease. Unintentional weight loss is a systemic symptom that may indicate an underlying medical condition, including colon cancer. Unlike weight loss due to diet or exercise, this type of weight loss occurs without any deliberate effort and may be accompanied by other subtle symptoms. From a biological perspective, cancer cells can alter the body's metabolism. They may consume a significant amount of energy and nutrients, effectively diverting resources away from normal bodily functions. Additionally, cancer can trigger inflammatory responses that further increase metabolic demands. Another contributing factor is reduced appetite, which may occur due to the body's response to illness or due to discomfort in the digestive system. Over time, this combination of increased energy consumption and decreased intake leads to noticeable weight loss. Clinical research shows that unexplained weight loss of more than 5% of body weight over a period of 6 to 12 months should be investigated. In the context of colon cancer, this symptom is often associated with more advanced disease, but can also appear earlier in some cases. It is important not to ignore this sign, especially when it occurs alongside other symptoms, such as changes in bowel habits or fatigue. Early medical evaluation can help identify the cause and initiate appropriate treatment. Persistent fatigue and weakness are common, but often overlooked symptoms of colon cancer. Many individuals attribute these feelings to stress, lack of sleep, or aging. However, when fatigue is ongoing and not relieved by rest, it may indicate an underlying medical condition. One of the primary causes of fatigue in colon cancer is anemia. Chronic blood loss from the tumor, even in small amounts, can reduce the number of red blood cells in the body. These cells are responsible for carrying oxygen to tissues. When their levels decrease, the body's ability to deliver oxygen is compromised, leading to fatigue, weakness, and reduced endurance. Patients may also experience shortness of breath, dizziness, or pale skin as a result of anemia. In addition, the body's immune response to cancer can release substances called cytokines, which can contribute to feelings of fatigue and malaise. Studies have shown that cancer-related fatigue is different from normal tiredness. It tends to be more persistent and may not improve with sleep or rest. This makes it an important symptom to recognize and evaluate. If fatigue is accompanied by other warning signs such as weight loss or bowel changes, medical consultation is strongly recommended. Blood tests can help detect anemia, while further diagnostic procedures can identify the underlying cause. Abdominal discomfort is another early symptom that may be associated with colon cancer. This can include pain, cramping, bloating, or a persistent feeling of fullness. While these symptoms are common in many benign conditions, their persistence or progression should raise concern. As a tumor grows within the colon, it can cause partial obstruction, leading to buildup of gas and stool. This results in increased pressure within the intestines, which can manifest as cramping or discomfort. In some cases, patients may also experience nausea or changes in appetite. The location of the tumor can influence the type of symptoms experienced. For example, tumors in the right side of the colon may cause more subtle symptoms such as bloating, while those on the left side may lead to more noticeable changes in bowel habits. It is important to monitor the duration and pattern of these symptoms. Occasional discomfort is usually not a cause for concern, but persistent or worsening symptoms should be evaluated. Medical assessment may include imaging studies or colonoscopy to determine the cause. Early diagnosis allows for more effective treatment and better outcomes. In summary, colon cancer often begins with subtle symptoms that can easily be overlooked. These include persistent changes in bowel habits, blood in the stool, unexplained weight loss, ongoing fatigue, and abdominal discomfort. While each of these symptoms can have benign causes, their persistence or combination should not be ignored. From a clinical perspective, early detection is one of the most important factors in improving survival rates. Screening methods such as colonoscopy can identify precancerous polyps and allow for their removal before they develop into cancer. This makes colon cancer one of the most preventable forms of cancer when appropriate screening is performed. Guidelines generally recommend that average-risk individuals begin screening at the age of 45. However, those with a family history or other risk factors may need to start earlier. Regular medical checkups and awareness of symptoms play a critical role in early diagnosis. If you experience any of the symptoms discussed in this video, do not delay seeking medical advice. Early evaluation can provide reassurance or lead to timely treatment if needed. If you found this information helpful, consider sharing it with others. Increasing awareness can help save lives. Your health is your responsibility, and early action can make a significant difference.